Welcome to COVID-19 Talk with Local Health Authorities. Joining me is Dr. Maria Rivera, representing Harris County, Dr. David Pearce, representing the City of Houston. And by the way, we apologize for that 7-minute delay. It was due to technical difficulties. You're going to hear David's voice, but maybe not him, but he's trying to get on a computer. I want to thank past President Kathy Fenninger at Rotary Club of Houston for sponsoring this event, and Morgan Ash, our producer. I'm Stephen Williams, the director of the City of Houston Health Department. Of course, we have a number of questions relative to vaccines. The first one is, what are the rights of those under 18 years old who want to get vaccinated, but their parents say no?
Yeah, so I'm happy to take that one. Unfortunately, in the state of Texas, you do need parental consent if you're under the age of 18, at least for the COVID-19 vaccine. That's not the case for every vaccine. It's not the case for every medical procedure, but for the COVID-19 vaccine, you do need parental consent.
Is it because it hasn't been formally approved by FDA or what?
Yeah, it hasn't been approved by FDA. It's under EUA, and it depends on the states. And in the state of Texas, it's a little bit more strict for the less than 18-year-olds.
Okay. 99% of people dying from COVID are unvaccinated. Is this true or false? David, you want to try it? Well, it's going to be on you, Maria.
Yeah, so what we're seeing is that those numbers are pretty true. There's been very few deaths in people that are vaccinated, and the majority of people that are vaccinated that have died are over the age of 75 or have other comorbidities, cancer, immunosuppressive diseases, etc. And so the vast majority, more than 99% of the people that have died are unvaccinated.
You know, this morning I read quite a lengthy article on by a doctor who actually is practicing in Utah, and he was talking about his interviews with people who hadn't been vaccinated. Some of them are healthcare professionals, and talking about the various reasons why they hadn't been vaccinated, even though they had witnessed people who were unvaccinated who had died. It seems like that is our public health challenge of the day.
Absolutely.
What is the effectiveness of just one dose on the Delta variant? Go ahead.
That's good. So one thing that we're learning, if we look at hospitalization specifically, and is that the effectiveness of just one dose is, and so if you've been fully vaccinated, the chance that you are going to have any form of symptomatic COVID infection is lower, but the chance of you getting severe COVID if you're fully vaccinated is extremely low. However, if you've only had one dose, we are seeing that some people have had to be hospitalized with COVID-19 after receiving just one dose. So we do know that it's decreased. We don't know what the percentages are or how much, but we do know that it's decreased.
I know both the city and county have engaged in outreach efforts for those people who have only taken one dose, trying to encourage them to get that second dose. I also had a situation that happened this weekend when I was out. A couple had passed their second dose vaccination date. Could you talk a little bit about that?
Yeah, so we know that there's some people that for whatever reason are scared to get the second dose, or maybe they were confused or whatnot. What we know is that ideally you will get it within a certain period of time, but if you haven't, if you're still missing your second dose, we still encourage you to go get it. The CDC hasn't put any limits on if this amount of time has passed, you can't get it anymore. If you haven't gotten your second dose, even if a lot of time has passed, you should go back to any vaccine provider and get that second dose.
Yeah, I gave them that advice only because I've been listening to you and David for the last couple of months. The nurse seemed surprised that I would go ahead and do that because I'm not a doctor, but I think she didn't realize that I was really just really mimicking you and David, because I'd heard it so many times. It's like, take that second shot. It's really important that you do that.
Yep, I agree.
JAMA retracted the study saying masks may harm children by exposing them to high carbon dioxide levels. Where did this issue even start?
Yeah, so there was a study that came out really early on in the pandemic. It was really being circled in social media circles, et cetera, that if you mask kids for a certain amount of time or for too long, their carbon dioxide levels can increase. And this past week, what they realized that there was a lot of weaknesses in that study, and so that study was retracted. But I think that there's a portion of the population that the reason that the study existed in the first place is just to try to figure out if we put a mask on kids for a long time, what happens, and it was trying to answer that question. And I think there's other studies now that have showed that there isn't anything wrong unless there's a child that has some form of pre-existing condition that can really put them at risk. And usually it's kids that can't control their own secretions or have other really severe illnesses, not things like asthma, et cetera. And so most pediatricians, or pretty much all pediatricians that I know, are really happy that that study got retracted, because we know that masks are protective to kids. The American Academy of Pediatrics and CDC both recommend that all children that are not vaccinated should be masked if they're over the age of 2. They're effective and they're safe.
The CDC just recommended that unvaccinated children wear their masks in the fall. American Academy of Pediatrics issued stricter guidelines and called for all school staff and students over 2 to wear masks in the fall. Who's making the decision locally, state, district, or schools?
Yeah, so the main issue that we have in the state of Texas right now is that there cannot be a mandate for masks in schools. And so at the state level, the governor has said that schools cannot mandate masks. And so that decision, unfortunately, has already been made at the state level. And so it'll be up to parents, and it'll be up to schools. And the recommendation is that especially if you're not vaccinated, children should be masking this fall in schools.
And so really, from a medical or a health authority perspective, we believe that children should be masked.
Yes.
Let's see, can we bring David into this? David, do you hear us?
Yeah, I can hear you fine. Can you hear me?
Yes, y'all can hear him, right? This whole issue of kids wearing masks in school, where are you on that?
Yeah, I agree with Dr. Vera and the AAP, the American Academy of Pediatrics. So, kids are most kids will do fine. We know that, but we also know that some kids are not going to do fine at all. We also know that kids inadvertently are great spreaders of the virus. And so we need to do everything we can to protect the kids and protect the families of those children. Remember, they go home to other kids who maybe have disabilities. They go home to grandparents. And so I completely agree with what Dr. Rivera and the AAP has already said.
And by the way, she is a pediatrician. Okay, cautions. Okay, let's go with this. 35 states increased cases more than 50%. Harris County data shows vulnerability is very high. Is this a post-holiday bump? Please update our local data, and we're trying to do that. Will we have another wave? How many people are currently hospitalized with COVID? Is anyone on a ventilator, meaning seriously ill in a hospital? I want both of you to take a stab at that, because the reality is people are still getting COVID and people are still dying from COVID in Houston and Harris County. David, why don't you go first?
Yeah, I'll go first since Dr. Rivera's been carrying this the whole time. And I apologize for the technical difficulties. But anyway, so this is not a post-holiday bump. This is the effect of the Delta variant, which has come to Houston. We first saw it, we first detected it in in wastewater in a couple of patients, really about 6 weeks ago, and it has very slowly taken off, and now it's got a lot of momentum behind it. So this is absolutely not just a post-holiday bump. Will we have another wave? That depends a little bit on what you define as a wave. I anticipate we will have a wave of infections. In fact, we're already seeing that, although it's hard to measure it because so few people are going and getting tested now. But of the people who are going and getting tested, the percent positive is going up rapidly, going up from a very low level, but it's going up nonetheless, and unmistakably it's going up. We're hoping that we won't see a big wave of new hospitalizations like we saw the last 2 waves, but that remains to be seen. And are people currently hospitalized? Absolutely. We've seen a significant rise in not only when you look at the SETRAC data, which looks at hospitalizations just within Harris County, is a very steep upward climb. And when we look at the TMC data, it's the same thing. And our friends at Methodist have been, who also sequence all of their samples, have shown that 85% of the hospitalized patients are infected with the Delta variant. So yeah, this is not a bump. This is the real deal.
And your perspective, Dr. Rivera.
Yeah, no, I completely agree with Dr. Person. We've been talking about this. This is unfortunately, we're in it now. We're seeing a huge increase. The Delta variant is extremely contagious, and we all need to start being really cautious again.
Okay, this next issue is really a statement. U.S. numbers look like we're in a spike with less than 50% of the population vaccinated. True. I think y'all just really spoke to that issue. I mean, the bottom line here is that we really need to get more people vaccinated. We respect and understand, people being very, very cautious and hesitant regarding vaccinations. But the reality is that the more people we get vaccinated, the better off we will be. Harris poll, July 9 through 11, found 62% of unvaccinated believe Delta variant makes me second guess whether I should even get vaccinated. With Delta less virulent, why should I bother? That's not necessarily factual. All right, straighten it out, docs.
Yeah, so we don't know if Delta is less virulent or not. Some studies have shown that it's actually more virulent or more severe. So virulent meaning severe. And some studies have showed that it's maybe just as type, but not necessarily less severe. It is definitely extremely more contagious. And one thing that everyone needs to keep in mind is that even if you're in a group where you are healthy, where you're young, if you haven't gotten vaccinated and you do get COVID-19, it's not just about getting severe COVID-19 and ending up in the hospital or dying, even though obviously we don't want those things to happen. But the chance of you then having long COVID-19 symptoms is now we're seeing up to 25%, in some studies even higher than that. And so you can have brain fog, fatigue, you can have heart damage that you don't even know about. And so all those things that are going to affect so many people in our community for the next few decades because of just an infection are things that can be prevented if you get the COVID-19 vaccine.
We really don't talk about those long-term effects that much. And, my fear is that if we start talking about it, people will think that, we're just exaggerating. But I just think that somehow we have to find a way to communicate that more effectively so people will understand. It's just not that, one situation where you have COVID, it's over. Any comments?
Yeah,
Go ahead.
There's a report on one of the local news medias last night about a study out of England that shows that there's actually measurable damage to the brain in some of these folks with a lot of memory loss and ability to solve simple problems. Some significant things which will impact people's productivity going forward.
Okay, FDA warning that Johnson & Johnson vaccine may trigger Guillain-Barré syndrome in a small population number, large enough for caution.
So I'll take this one. So it is very small, and Guillain-Barré occurs naturally anyways, and it is sometimes you can't figure out why. Sometimes people get infected with the virus and their immune system that overreacts and attacks your own nervous system. It has been associated with some vaccines in the past, but it's literally the one in a huge number, whether it's 1 in 100,000, 1 in a million. It's a tiny, tiny number. And we've seen this with other vaccines. And the reality is that the risk with the vaccine remains much smaller than your risk with the virus if you get infected by the virus. Going back to something you said earlier, I think people need to recognize that if you want to, there's no way to completely avoid risk. You can't avoid the risk of the virus and avoid the risk of the vaccine unless you're going to live in a cave and not talk to anyone, have no interaction with anybody probably for the rest of your life. So you're at a point now where you get to choose which risk you want to take. And the risk with the vaccine is exceedingly smaller than the risk with the virus.
Millions are being pumped misinformation through social media, and the U.S. Surgeon General called COVID's misinformation an urgent threat. Many intelligent people have stopped listening to contradictory experts. I have personally given up trying to persuade my "I refuse to be vaccinated" friends. Where do you believe the responsibility lies for controlling this misinformation?
Yeah, that's a really difficult question. Obviously, we're on here live every other week now to try to combat misinformation and try to give people information that is accurate and scientific and is supported by evidence. And we know that one thing that's really tricky is that there isn't a lot of evidence for COVID-19 because we're making the evidence as we live it. We are going to know a lot more about it in 10 years as we look back. But as to who's responsible, I think that I agree with the Surgeon General. I think the misinformation on social media is rampant. I know that a lot of the CEOs of a lot of the social media companies are trying to combat it. I hope that they continue to do that and continue to do more of that. And then I think that it's also a lot of things are just already out there and not just on social media, but other websites, etc. And the only thing that we can do as health authorities and as public health officials is to continue to spread our messages, the messages of science, and trying to also connect with as many people as possible to allow them to ask us questions directly.
You know, it really hits home personally, I think, for a lot of people. Actually, folks, I'm not in Houston today. I'm actually in Saginaw, Michigan, visiting my mother-in-law, who is 97 years old, and my wife's best friend is not vaccinated. And of course, we're saying, you know, no, you can't interact with someone that you've known all of your life, because it would be extremely risky for a 97-year-old woman to be exposed to folks that are unvaccinated. And so you really have to make some personal choices that are sometimes uncomfortable. People are being treated poorly who have gotten a vaccination, regardless of their reason, who have not gotten a vaccination, regardless of their reason, as to no one bothers to engage them in conversation. Shouldn't we just put our mask on and be quiet? You know, I just talked about that myself, you know, and when I encounter that, I really do try to give people the facts. You know, no, the vaccine wasn't created in 3 or 4 months. No, it's not perfect, like David has said it is, but it's less risky than getting COVID. So, you know, I just believe that we have to make some personal choices. I believe that as individuals, we all have to be ambassadors of creating a healthier community relative to COVID.
Agreed.
That's all you can say, David? I'm kidding you.
Yes, you can say well said.
Okay, I'll go on to this one then. That was supposed to be an intro for y'all to say more, but that's okay. Booster shots. Israel is starting a booster of Pfizer for those vaccinated with impaired immune systems. Some countries have already are already talking about them for everyone, and Pfizer supposedly to be proposing a booster to regulators, pushing for a 3rd shot at 6 months of the original vaccine. Since information changes constantly, what is the latest on this? Is the 3rd shot just a moneymaker for Big Pharma? I think a lot of people are asking that question.
So, you know, I don't know what the latest is. When they put in the request to the FDA for the 3rd dose, they're going to be supplying data to support their request. And I've not seen that. I don't know, Dr. Rivera, perhaps you have. I've not seen that, but that's going to be really important to help me, you know, judge whether a 3rd dose, whether it be just for people with impaired immune systems or for everyone, is necessary. We do clearly know, we've seen that those with impaired immune systems, those being people with chronic immune problems, organ transplant patients, chemotherapy patients, and the elderly, where not unexpectedly, the vaccine does not always provide the level of protection that we would hope for. But we've seen this with other vaccines, so that's not a huge surprise. The question is, does the 3rd booster, the 3rd dose, the booster, does it really make much of a difference? Does it improve on that situation? And that I'm not aware of. I don't know, Dr. Rivera, have you seen anything?
No, I think we're still trying to figure that out. I have not seen anything.
Is it true that MNRA affects mammograms by a temporary inflammation of the lymph nodes on the side of the body that was vaccinated?
A handful of women who have had the mRNA vaccine and then got a mammogram right after that, they noticed that they did have swollen lymph nodes. And so now there is caution that if you are scheduled to have a mammogram, I'm not quite sure what the time frame is, but to not have a COVID-19 vaccine right before it, because it could cause a false positive because of the possible inflammation. That's just a natural reaction to the vaccine, to have some inflamed lymph nodes, and it just happens. And sometimes women don't even feel them; they just show up on the mammogram because that's one thing that is being looked for.
And I think that's very interesting. Actually, I knew a couple of colleagues that had to go back, and I don't know that that link was actually made by them or by their doctor. But the second mammogram showed up okay. So. Do vaccinated mothers pass COVID antibodies to babies in utero and through breast milk? Does it matter if it was through catching the virus or getting the vaccine?
I'll let our pediatrician answer that one.
Okay. So what the early studies are showing is that yes, if the mother COVID-19 vaccine and then delivered a baby, there are some detectable antibodies in the baby. And one thing that's really interesting about breast milk is if a mother is breastfeeding and they get the COVID-19 vaccine, and they test the breast milk, there is detectable antibody in the breast milk as well. What we don't know is how protective that is. Like, we don't know if a baby has positive antibodies after the mom has had COVID or has gotten the vaccine, if they're truly protected or not. We don't quite know if a baby is taking breast milk that's antibody positive, if that's protective or not, or to what level. So that's something that I think scientists are still trying to figure out.
It seems like breastfeeding still needs to be promoted.
Yes, absolutely.
Dandelion extract for COVID protection. Don't make that face, Maria. Go ahead, David.
Okay, I wish I had taken the previous question. So actually, I have read about this, and there is, many of our medications that we have today originate in plants. Mm-hmm. So, for decades, that's where all of our medications originate from, was basically from plants. Now they're, pharma can actually manufacture some stuff. So it's not a surprise we might find something in a plant. There is an extract within dandelion that in the laboratory, basically in the petri dish, will slow down will prevent infection of the Delta variant into cells. However, that is a long stretch before we could make anything clinical out of it. So there's an interesting finding there, and it needs to be followed up on. But at this point, it's only found to work in the laboratory. So
it's not that far-fetched.
No, it's not. It's really not that far-fetched. But for this particular dandelion extract, there's a lot of testing that needs to occur before we can find out whether it's going to be clinically helpful or not. But, I really applaud the folks that are looking under every rock to find something that's going to help. And so this is good news. But this is not a panacea.
My fear is that people that are hearing us to go out and get dandelion extract, although I don't know where to buy it.
Yeah, no, and I guess, thank you. That's exactly my point, is that I think that the ratio, I don't know what the exact ratio is, but for every discovery like this that we find, there's thousands that we find that wind up not actually being clinically useful for everyone that's at this stage. So the chances of this actually becoming something that you can rely on is infinitesimally small. I'm just glad that we've got people who are, looking under every rock. In fact, going back and looking at plants to see if there's something there. It just is a testament to the scientific community and how much effort is being put forth to try to find something to help stop this pandemic.
Okay. Aren't virus mutations weaker in general?
I'm not quite sure what they mean by weaker, but usually virus mutations are very, very common and expected. And what we've seen with the COVID-19 virus, SARS-CoV-2, is that the mutations have caused the virus to become more contagious. So I wouldn't say that it's weaker. I think it's much more likely to infect other people. There are some strains that we know are more severe and cause more severe illness. And unfortunately, when there are the virus mutations that essentially win, because the virus can mutate even multiple times a day, but the ones that win, such as Delta, is because they're more contagious. They can get to more people, and sometimes they can cause more severe illness.
So they're not necessarily weaker.
No, if anything, a lot of them are stronger, if you want to use those terms.
Yep. Effectiveness of monoclonal antibodies and Delta variant.
So there are multiple monoclonal antibodies that are being used clinically right now, and there's 4 big ones. One of them has been found to not be effective against the Delta variant. That's the Mammograms. None of these are easy to pronounce, by the way. The other 3 are still effective, but that one has been shown to not be effective. That's my understanding.
Research at the University of Rochester seems to show that people who have had severe cases developed a stronger immune reaction than those with milder forms of the disease. And natural immunity and vaccine-induced immunity seem similar. So if I had a strong reaction to the vaccine, does that mean I have a stronger immunity?
Not necessarily. We've seen some people who have had no reaction to the vaccine at all are still protected, and some people who had, as the people who had really strong reactions. And so what types of symptoms that you had are not necessarily indicative of how strong your immune system is to the virus.
U.S. life expectancy is down in general. Specifically, what is the impact of COVID on this?
So that's a more complicated question than it sounds. So we've seen the life expectancy drop, and that's related to people dying at younger ages. And when we look at that, clearly we've got 600,000 plus Americans who died from COVID. Yes, many of them were elderly in the beginning, but over the last several months, it's been younger and younger people that have been dying. But also to this question, the impact of COVID, we've also seen increased deaths from cancer, heart disease, and other things because people delayed their care. So they were afraid to go to the hospital because they knew the hospital was full of people with COVID, so they didn't go when they had their chest pain. Their heart attack was worse. Some of them died at home. Some of them, they just wound up with more heart damage, then went on months later, to die from congestive heart failure. Other people had a lump or a bump and they didn't get it evaluated. It turned out it was cancer. And by the time they got it diagnosed, they were in stage 3, stage 4 cancer because they didn't go to the hospital. So the impact of COVID is greater than just the 600 plus thousand Americans who died directly from COVID. It's all these other deaths as well. And when you add those all together, that's why the U.S.
Okay, just one quick last question for both of you, and it's really short. There's a lot of things that are going on that's really conflicting, related to unvaccinated, related to the Delta variant. What's next? What's your advice for going forward?
The advice that we can give right now is that if you have not gotten vaccinated, go out and get vaccinated as soon as possible. And we'll just keep it short.
And David?
Yeah, and I would say that, here in Southeast Texas, we're seeing the numbers go in the wrong direction. Things are positivity rates are going up, hospitalizations are going up. The Delta variant is extremely contagious. Certainly, if you're not vaccinated, you really need to think long and hard about getting vaccinated. If you're not going to do that, you need to think about wearing a mask and avoiding crowds. And even for those who are vaccinated, especially if you've got immune system problems, your chemotherapy, organ transplant, elderly, you need to get your guard up again, even though you've been vaccinated, because when you walk into an environment where it's just teeming with a variant, you run the risk of contracting it, even though you've been vaccinated. The vaccine is not 100% effective. It's highly effective, but if you put yourself in the wrong situation, you run the risk of contracting the virus.
Thank you for joining us for COVID-19 Talk with Local Health Authorities. Joining us was Dr. Maria Rivera, representing Harris County, Dr. David Perch, representing the city of Houston. Special thanks to past President Kathy Fenninger, Rotary Club of Houston, and certainly Morgan Ash, our producer. I'm Stephen Williams, the Director of the Houston Health Department. See you next time.